Hi, I'm Dr. Lisa Vuich. In this video, you'll see me do a MINT PDO thread lift along with tear trough filler. These are two of our most advanced injectable procedures. However, they're extremely safe, and they're something I do every week at Renew Meta Spa. If you have any questions about these procedures, please feel free to reach out to us. All right, we're here with Jackie today, who has done threads before. And we're going to be doing MINT PDO threads to her mid-face and also to her jawline. And Jackie, you've had a pretty good experience with threads in the past.
Excellent.
The MINT PDO threads are actually the only threads on the market with 3 different FDA clearances for tissue repositioning, so that's definitely unique for them. And we do feel that they have the best lift as well due to the barb design. So what I'm doing right now is I'm actually planning out the main threads for Jackie. We'll be doing threads specifically to her cheek and also threads to her jawline to really basically take what she's got and contour it up further. So that's going to give her more support in her under eye. It'll give her a cheek lift, and it'll also give her a better looking jawline. So the first stage is just laying out the pattern for the threads, and then after that we'll show you the numbing, and then one by one we place these threads through just small needle pokes. So there'll be 2 needle pokes here, and the threads will actually pass all from this area. This is where they'll be fixed to. We'll have threads to the cheek, threads to the jawline. What I'm going to do right now is start the numbing process. We need to numb the starting point, the ending point, and then we'll separately numb the paths. So the goal is that by the time we're passing the threads, all that Jackie is going to feel is some tugging and some pressure. So this will get rid of anything sharp or really uncomfortable. The lidocaine does sting a bit, as Jackie knows, so I'm just going to give you a warning here. Pinch and some sting. So this region will be our entry points. How are we doing? Okay? A little bit of a sting, right?
Just a little.
Good one here. So we do our best to avoid bruising with this. Of course, you can always get something somewhere. Have you had much bruising in the past with threads?
No, I've been really lucky.
Yeah, it's usually pretty minimal, you know, with certain techniques we use. And this buzzer I have in my hand is just a little bit of a distraction. Good. Okay, and as you can see with this, there's really very little, if any, bleeding. Most people will do thread lifting once a year. Although once they've done it several times, they can often start to go longer in between those appointments, maybe a year and a half. Okay. All right, very good. You good? All right, so as I mentioned, we're going to be going in through just a couple of needle pokes. So I'm going to go ahead and make that first one. And Jackie, all you should be feeling is some pressure. So if at any point you feel anything sharp or uncomfortable, you let us know. And when we're done, she'll just have a little Band-Aid out here. There are not any sutures required. All right. All right, a little bit more turn. Is that okay on your neck?
Mm-hmm.
All right. So you're gonna feel me shake and wiggle a little bit, and that's because these threads are on dull cannulas. And we gotta kind of encourage them to pass through the tissue. How are you doing?
Fine.
Good, okay. I'm gonna go right down to the cheek. Are you feeling anything other than pressure?
Nope.
Okay, so that is in there. This is a cannula that's got the thread inside of it. Now I'm gonna twist, turn, and now the cannula is out. So that just leaves this thread behind. And we'll engage those barbs. So this is in place now, and it's able to give a little tug and lift to the cheeks. So I'll go ahead and press that down. Good. And now we'll do another one, similar path, going into the same entry point and a little bit different angle. How would you describe this sensation, Jackie?
Honestly, it just feels like your fingers are wiggling my cheek. That's all I feel.
All right, so right now I'm just pressing, I'm setting those barbs. The barbs are the part of the thread that's irregular or rough, which allows it to grab onto that subcutaneous tissue and hold it in place. And now we're going to tie these, little knot here to help secure them. This material will dissolve over the course of months, but you build a lot of collagen around the threads while they're in there, so that collagen lasts for years, which is nice. Now that was me just burying that knot. So if you heard a little click,
I did.
that was that. All right, so you can see already how lifted the cheek is, which is great. Now we're going to put in a thread called a fixed thread. A fixed thread is a stabilizing thread that helps make sure that nothing will shift back down. So these have special barbs to keep everything in place. The passing is very similar, so I just got to get my plan of attack here. And you're going to feel that little pressure again. All right, that's in there. I'm going to lift everything up real high. Good. So I know it looks a little crazy because of the metal that the threads are loaded on, but you can see the placement is very straightforward. Good. And this is mostly a two-man job with Ariel handing me everything she knows I need. That just makes everything go a lot quicker. So the threads to the cheek are done, and now we're going to target threads. You can probably already see the jawline looks better because things got tugged up, but we're now going to, we want a lot of collagen build along the side here. So we're going to put 5 threads actually total here that are all going to want to lift this way. And as she builds that collagen, over time she'll get more tightening as well from the collagen build. Now this thread that we're going to use is different. This thread doesn't come, or at least this version of it doesn't come preloaded on a cannula. So these threads come packaged loose. So I'm going to be using this to basically create the path for the thread. I'll actually give us a different hole for this. Thank you. So I'm going to start from here. Again, Jackie, you shouldn't feel much with that. So it's the same thread material. It's just not preloaded on the metal cannula. And again, the cannula is dull, so it requires a little bit of work to pass it gently through. You doing okay here? Feel anything other than pressure? No. All right, so that's in place. Now, thread lifting is not the same everywhere you go. First of all, there are quite a number of different thread brands. Some are better than others. Of course, the skill of the person performing the procedure is important, training. But also, the result of a thread lift is heavily impacted by the number of threads that are used. Within reason, the more threads, the more collagen, the more result. So that's one thread in place. And so I do sometimes talk to people who come for consultations and they say, oh, I had a thread lift and it didn't do anything, or it lasted 2 months, or, you know, something, not a good experience. And pretty much routinely, if I ask a few more questions, you know, like, well, how many threads did you have done? You know, sometimes I hear, well, they did 2 here and 2 there. All right, if you do 2 threads to an area, that's going to give you, you know, a limited result. And as you can see here, we did 3 to the cheek. We're doing 5 to the jawline. That's a much higher likelihood of producing a nice lift and a long-lasting result. Because more threads, more lift, more collagen. Again, within reason. It's not like we would do 20 per side or anything, but you want to use a generous amount of material in order to get the best outcome and the longest lasting result as well. Now, it's normal with the thread lifting to initially have a little bit of tug or pulled look. We try to make that as subtle as possible, but it will be there a little bit, especially in the first 3 days. You can usually see a little something. Do you recall ever having that, Jackie? Like a little bit of a dimple or?
Yes,
Yeah.
very minor.
Minor. We keep it minor. I mean, there's ways to keep it minor, so of course I do that. What I'm feeling for here is just that I'm at the right depth and that it's passing fairly easily. All right, so that's a good path there.
Thank you.
Does the lidocaine make you tear up?
Yes.
Yeah. Yeah. Because we put the stabilizing threads in at the end, what I call the MINT fixes, it really doesn't matter how someone sleeps afterwards. There's going to be a lot of resistance to any of this shifting significantly because of those special stabilizing threads. So we generally just tell people no aggressive exercise for a couple weeks is nice. Things like running, jogging, burpees, combat class. That's stuff that's a little bit, more like the faces flopping around. And that's honestly more for comfort than anything. Because in the beginning, when you have these threads in, if you make really fast, rapid facial movements, you might get a little zinger, little twinge. And if you're pushing it with your facial movements, you can get that. Do you recall those at all? A little zinger, like you'd all of a sudden feel like yeah. And that's normal, but obviously we don't want a lot of that happening. So it's good to just kind of tame it down on the exercise a little bit.
All I can feel is you touching my face, really.
Mm-hmm. A lot of times I feel people are intimidated by these because it does seem more surgical, but really this technically isn't more invasive than dermal filler or a lot of other things we do here. It's just, it's definitely an advanced technique. It's not something you can find at all medical offices that do aesthetics or all spas, medical spas, but we're going to put one of these fixes in back here again to help ensure that things won't shift around on us. They have special barbs that go back and forth, and just want the skin to stay exactly the way I put it. So it's very important I get it in position nicely before I pull it out. Good. All right, let's take a look here. Good, very nice. Perfect. All right, let's go to the other side. Now, the other thing that's really important, I feel, with threads is clean placement. So I do sometimes get a little upset when I see online people posting videos of threads and the thread is dragging through someone's hair as it's going into the face. I mean, that's really not nice. Kind of makes me crazy. You can see how, this isn't necessarily a sterile procedure, but we definitely want to be careful about what the thread is touching. Good. You okay in this cheek?
Yep.
Okay. Because it is a foreign body in the face, even though it's just surgical sutures. So we try to make sure that anything it touches, including my gloves, is sterile. These drapes are sterile. The skin was sterilized, not only with alcohol, but with a surgical soap. All right, this is our stabilizing thread. Okay. All right, let's go way there, way up. Numb up there, you're good?
Yep.
Okay. When I first trained on threads back in 2015, there weren't even really training programs in the US that were good. I had to go to London to learn how to do this.
Oh, wow.
Yeah. All right, that's got a good pull there. Not every thread lifting case is the same pattern. I mean, this is a common pattern that we use, but sometimes we have different starting points and such. This, I would say, is the most common pattern that we use. You might also notice in the video that I am intentionally not touching. Even though my glove is sterile, I intentionally don't touch the part of the thread that remains in the face. I'm touching the end that's going to get cut anyway, but trying not to touch anything that's actually, because these threads are, I don't know, quadruple sterilized, so I know that the thread itself is perfect. Did you find afterwards, Jackie, that you had to take anything, any Tylenol or Motrin or anything like? Yeah, most people don't. You would think you'd be more sore, but
No, never been sore at all.
there is, you know, some minor tissue trauma here, obviously, as the metal cannula is going through the tissue, but that's all going to be collagen stimulating also. So now the barbs on the mint threads, the little, you can probably almost see them, but those little projections are really very specialized. It's what gives them their lifting strength. They're what are called molded barbs. So they're thicker than the barbs on some other threads, and they're really well positioned for the maximum lift. So that's one of the main reasons we prefer this particular brand, is because it's a molded barb thread. And again, that stabilizing thread will just guard against things shifting. Doesn't need to be tied to anything. Good. All right. So we have a total of 8 threads, I believe, to each side. You can see there's no bruising. There's just 2 little needle poke entry points. We're going to cover those up with a Band-Aid, and we'll redo photos in 3 months. That looks nice. All right. So the last thing we're doing for Jackie is some under eye filler. Again, we use a cannula for this so that there's very low risk of bruising. And we're just giving her a little volume boost in that under eye area. So these micro cannulas are dull and they're flexible. So I had to make a little needle poke to be able to get it in there and under the skin. And then we just get where we want to. I think you've done this probably 3 times? Mm-hmm. Yeah. Usually this lasts for a good year, sometimes longer.
Yeah.
And we definitely don't want to overfill this area, but we want to give it just enough so that it doesn't shadow so much. And when I pass the cannula, do you feel anything other than pressure?
No.
No. Yeah, good. All right. Perfect. Nice. A little bit of pressure, that's it?
Mm-hmm.
How are you feeling? Okay.
Honestly, I hardly feel anything.
This filler is called RHA Redensity. It has very little tendency to draw water to itself, so that's important to avoid excess puffiness in the under eye. And it's also super soft, super natural looking wherever we place it. It's a common one we also use for fine lines, especially on the lower face. So I'll just create my entry point. You shouldn't feel that at all. Or just pressure, I should say. might need to change your angle on this side. We'll see. Okay. And I'm feeling like we need a little bit out on the sides as well. So I saved a little bit for that. Now for that, I'm going to use a different technique. I'm going to transfer some of the filler to a Botox syringe because this needle's even smaller. So we'll get the filler in there, or some of it. All right. And then put the plunger back in. Now, Jackie, because I transferred it, there'll be a little air bubble in there. So as I'm putting it in, you're going to hear probably a little like crackle or air bubble noise.
Okay.
So don't be alarmed. All right, similar to a Botox pinch. 1, 2, 3, pinch. And you're tearing still from the lidocaine. Are you feeling that at all?
No.
No. Okay. Good.
I think that's the worst part, tearing from the lidocaine.
Good, and you can see how that just kind of filled that little spot in. So we'll do just a little bit more of that. So these are needle pokes. It's always possible to bruise from this procedure, but usually not or minimal. We'll try to be very careful about where we go. Good. That's nice. We don't want to overfill, so we'll leave that. All right, so I'm targeting that little depression right there. Feeling where the bone ends. All right, Jackie, 1, 2, 3, pinch. Position a little bit. Doing okay? Feeling just a little pressure? Yeah. Blend that in. And one more. I'll go in the same spot, but angle that way. That is beautiful. All right, you are done.